Hello. Hi. Welcome to Medical Pearls, the series of video presentations packed with hail and hearty words of wisdom, designed to empower the knowledge of the general public on remedy and malady. Presented by Dr. Ranjith Peiris, General Practitioner, Family Physician, former United Nations Physician. Under the major topic of ROLLBACK COVID, and under the subtopic of Genesis of COVID-19, Induction and Evolution of COVID-19, and Unraveling the Confusion of Different Names for the current global pandemic. The isolation of the first ever human coronavirus was done in the year 1965, from several patients with the symptoms of common cold. There are several connotations for the word corona. One such application describes corona as something resembling a crown. Therefore these viruses were also given the name corona, since the outer covering of these viruses was studded with club-shaped spiky proteins or projections, looking similar to the projections from a crown. Both human coronaviruses and animal coronaviruses fall into the broad family of viruses known as coronaviridae. The first animal coronavirus was identified in 1930, but estimated to have been there with the animals for several millions of years. Animal coronaviruses can infect the animals, such as camels, bats, cattle, and rodents. Frequent and closer interactions of human beings with infected wild animals, farm animals, or domestic animals, whether these infected animals are dead, alive, or slaughtered, create the ideal environment for the transmission or spillover of the animal coronaviruses into the human beings. These closer interactions of the human beings with infected animals or animal products frequently occurs with petting, animal farming, animal bites, animal care industries, mass deforestation, and in open-air wet markets. In these open-air wet markets, the farmers, butchers, traders, vendors, customers, and even the healthy animals are at the risk of exposure. Banned species of game animals such as ferret badgers, raccoon dogs, civet cats, and pangolins are also available for sale in these wet markets. Unlike their natural habitats, these distressed animals get crammed together close to each other in smaller spaces, providing an ideal environment for exchange and spillover of the animal viruses, and swapping of their viral genes with each other. This process of chromosomal changes and the formation of a new virus is often a gradual process, and it may take several months of closer interactions with these infected animals. This virus is entirely new to the human immune system, therefore cannot be neutralized by it, and the ultimate result is the unhindered reproduction of this new virus in human beings, resulting in human epidemics, pandemics, and ultimately a global pandemic. Bats were supposed to be the original source or the primary host or the natural reservoir in 5 out of 7 human coronavirus infections. Human coronavirus infections were self-limiting mild infections, until the emergence of 3 virulent human coronaviruses. And these virulent human coronaviruses were the SARS Coronavirus that was isolated from southern China in 2003. Middle East Respiratory Syndrome or MERS coronavirus that was isolated from Saudi Arabia in 2013. And the 2019 novel coronavirus or COVID-19 that was isolated from the Wuhan province of China in 2019. These viruses are probably non-pathogenic or not responsible for causation of any infection in the bats. But these bats continue to transmit the virus into the other susceptible animals known as the intermediate hosts. In the intermediate host, these coronaviruses undergo further changes, mutations, adaptations and multiplication before the final transmission of these viruses into the human beings. These intermediate hosts, with reference to the three virulent human coronaviruses, were D. civet cat, with SARS 2003, and dromedary camels with MERS. With reference to COVID-19, pangolins and D. snakes are the probable intermediate hosts. The current corona pandemic was named as coronavirus disease 2019 since this disease was first described in December 2019. The combinations of the first two letters of C and O from the word corona, the first two letters of W and I from the word virus, first letter of D from the word disease, and the last two digits of 19 from the year 2019, were added together to designate this new viral disease as COVID-19. On 11th of February 2020, International Committee on Taxonomy of Viruses, or ICTV, announced the name of this new virus as Severe Acute Respiratory Syndrome Coronavirus 2. On the same day, WHO also announced the official name of this new viral disease as COVID-19. Therefore, the name of the disease is COVID-19, and the name of the virus is Severe Acute Respiratory Syndrome Coronavirus 2. Different names are being applied from time to time for the current global pandemic. These names are: Number 1, Severe Acute Respiratory Syndrome Coronavirus 2. Number 2, Human Coronavirus 2019. Number 3, 2019 Novel Coronavirus. Number 4, COVID-19. But the most popular names are COVID, Corona and COVID-19. SARS stands for Severe Acute Respiratory Syndrome. The SARS coronavirus disease initially came into the picture in the year 2003, and this virus is genetically related to the current SARS coronavirus 2 or COVID-19. Although these two viruses are genetically related, these two viruses are entirely different from each other. To differentiate these two SARS viruses, SARS virus of 2003 was named simply as SARS Coronavirus, or more specifically as SARS Coronavirus 1. And SARS virus of 2019 was named as SARS Coronavirus 2, and the disease caused by this virus is COVID-19. Case fatality rate, or CFR, is the number of deaths from a particular disease as a percentage, or it is the total number of deaths multiplied by 100, and divided by the total number of patients from the same disease. This is a good tool to compare the severity or the virulence of a disease. Less virulent diseases carries a lower case fatality rate, or CFR. Case fatality rate was 9 to 10 deaths per 100 patients with SARS 2003. Case fatality rate was 34 to 35 deaths per 100 patients with MERS. Case fatality rate is 2 to 3 deaths per 100 patients with COVID-19. Therefore, the SARS virus of 2003 and MERS were more virulent than SARS virus of 2019 or COVID-19. Although COVID-19 is less virulent with the lowest case fatality rates, the COVID-19 is much more infectious, highly contagious, and highly transmissible than the cyst viruses of MERS and SARS 2003. Therefore, the total number of patients and the total number of deaths with COVID-19 or SARS-2 are much higher than with MERS and SARS-1. The end of the video presentation on genesis of COVID-19. Thank you for watching. Last but not least, very special words of gratitude and appreciation for the free-to-download sections or the subsections from the websites of Pixabay, Raw Pixel, Unsplash, Creative Commons, Google, Public Domain, CCD, U.S. National Library of Medicine, for their invaluable contribution in providing with the images, vector graphics, illustrations, and videos, which were immensely helpful and valuable in the creation of this health educational video, dedicated to empower the knowledge of the general public on medical topics. If you like this video, please give us a thumbs up, subscribe and share.